If you are struggling in figuring out which special orthopedic tests you're going to use, depending on the signs and symptoms you see with your patient, then this video is for you. Hi, my name is Steph, the massage therapist, and for today's episode, we're going to talk about how we practice special orthopedic tests per condition. So if you're ready, let's get started. I'm going to make this quick and easy for you. In massage therapy school, usually they teach you special orthopedic tests to help you assess conditions so that you can create a safe and effective treatment plan for patients. But the usual problem that I see during this time is that the therapists are having a hard time connecting two and two together. Like, which tests are you going to use to figure out what would be the problem? And for today's video, that's what I'm going to be teaching you. So let's say I have here the screen. Let's put a sign and symptom. Let's say the patient is experiencing pain, anterior wrist with numbness, let's say paresthesia, or numbness and tingling. That's what paresthesia means. On the thumb to the index finger, and they feel it more at night. You know what I mean, okay? I'm gonna expand this so that you read. So, this is what the patient came in for, right? Patient is experiencing pain on the anterior wrist with paresthesia on the thumb to the index finger. So, these three fingers, and they feel it more at night. Now, this is where we start jumping and saying, oh, definitely carpal tunnel. But how can you prove that? That's the question. So this is how I would usually do it. First, I would pick a test to use. So I'm going to try to think of all the tests that may be positive with this one. Definitely, it's probably carpal tunnel, right? I'm going to try to find the condition first. It can be carpal tunnel. I'm going to add that in. Another version of what I can think is that you have to think about the possibilities. It can also become a median nerve lesion. So I'm going to think about that too. Median nerve lesion, right? And then what other things can I think of that can be similar to this? So let me say, what's a good one that's sometimes I think about is the pronator teres syndrome. Because it can be from here, like the elbow part, but it does the same signs and symptoms, right? Now that I have chosen three conditions that I think would be the reason that this can be a problem or connected to now that I've chosen three conditions, I have to double check. Is this really the only conditions that can be related to the symptoms? Doesn't matter if it doesn't fit the box yet, but you have to think outside of the box. You think about all the possibilities. You know what? I'm even thinking of thoracic outlet syndrome or TOS, because sometimes it has numbness and tingling on those areas, or so I would assume that can be one of the issues. And then from here, I'm gonna really try to pick a test. So now that I've picked multiple conditions, and the reason why I picked this is because I was looking at the symptoms if ever a patient would experience it. So for example, for TOS, the reason why I picked TOS is because I know that numbness and tingling down to the arm is one thing that can happen when you have TOS. The same thing with pronator teres syndrome, right? They can also feel numbness and tingling in the arm and in the hand. Median nerve lesion is another thing because obviously that's the biggest thing, especially that it connects with the thumb, index, and the middle finger. And then carpal tunnel, for me, is the closest one because it's in the anterior wrist. So yes, even though we know already that this is carpal tunnel, I'm teaching you how to pick the test. But let's say there's a situation that you don't know what this thing is in yellow. You don't know what this is. So at least we can figure things out, right? So what's going to happen? Now that I've found a couple of tests, what I'm going to do is I'm going to find a test that would be appropriate, right, for these tests that I would be performing with the patient. Pronator test. And I'm gonna pick maybe Adson's test or Wright's. Now that I have correlated some special orthopedic tests based on the conditions that I think that's very related to my initial story here, which is a pain on the thumb, in the wrist, to the thumb, to index finger, the next thing that I would do is perform them, and whatever is positive, then that would be the test that would give me the correct answer, proving that hypothetically, if they did the test, it would be carpal tunnel, right? So this is how I see things when it comes to assessment. I try to correlate the condition to the symptoms, and then whatever condition that is, I find a test that's related to it. And this is where the hard part comes in. That's why I'm going to repeat it. This is the process. You find the signs and symptoms and find multiple conditions that would have similar signs and symptoms. So for example, numbness and tingling, all of these things can be correlated with carpal tunnel, median nerve lesion, pronator teres syndrome, and TOS. And then once I pick those conditions, I'm going to start picking one test under that and start performing it. And whatever would be positive, then it's most likely the thing that you're looking for. If you are still getting confused with this, you can repeat the video. But again, find the condition that matches the symptoms that's being shown to you, and per condition, find the test so that you can use the test to confirm if your guess is right. And if you're still having a hard time with this, then maybe my study guide would help you. Again, this is just a summarized notes, right, to figure things out. So for this one, I already summarized the table of contents based on the joint and the conditions under it, right? So for this perfect example, we should go for a wrist and hand test and click that. And now I would see multiple conditions under the wrist and hand tests. So under the wrist and hand tests, we have lunate dislocation, de Quervain's tenosynovitis, carpal tunnel syndrome, ulnar nerve paralysis, circulation test of the hand. So meaning to say, I'm just going to try to find a good test under this condition. And because I know that under this list, Phalen's is one of the tests that I would use, then that's why I picked it for carpal tunnel. Now, if I want to pick something for median nerve lesion, I am just going to find it on my, I'm just going to find it on my list here. There you go. Median nerve lesion. So I'm going to pick either ULTT1 or ULTT2 to perform to see whether if it's really a brachial plexus or upper limb nerve root tension, specifically on the median nerve. And if it's pronator teres syndrome, I'm just going to look for it here. And if it's TOS, and then I'm just going to look for it here. So this is how I organize my notes to make sure that just in case when I'm in clinicals, I'm just going to look for the joint and find the condition. And then whatever condition that is, I'm going to pick the test under that. So for example, if it's cervical nerve root compression, then I'm going to try to perform these three. If it's about scaling trigger point, then I'm going to perform these two tests, right? Some tests, I only have one for each. So sometimes you really need to dig in. Again, these are just extra notes that I think that can help you navigate things. But these are the common tests that you may be using in your clinical practice, right? So if you're practicing for OSCEs and stuff like that, this might help you study. Don't 100% rely on this because there are more. But this is just a list per condition, per body area. Because now if you have organized your notes to something like this thought process that I showed you earlier would be a little bit easier because you're only going to look for a condition that matches the problem and then a test under that condition to figure out what test you should perform. And in that way, it would be easier for you to navigate things going forward. So again, if you like this video, please do not forget to like, comment, share, and subscribe. And again, I would put the link down below on how you can get my free study guide for orthopedic tests that are divided per condition to help you study for assessments. And again, my name is Steph Massage Therapist. See you next time. Bye-bye.